اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي اللهم إني أسألك علما نافعا ورزقا طيبا عملا متقبلا شفاء من كل داء. Part 2 of the lecture, that is labor and delivery. Today I am going to explain about the absolute indications for the caesarean section. 2 or more previous caesarean section, transverse lie, repeat antepartum hemorrhage unless placenta previa can be absolutely excluded, non-contracted pelvis. If the pelvis is contracted, then of course every time there is caesarean section is indicated. Complex twin presentations, for example breech and transverse lie. Vaginal birth after caesarean, VBAC. There is maternal risk of death, of course, and no maternal death ever attributed to scar rupture. Scar rupture, much confusion in the literature over the definition. Rate of asymptomatic scar rupture, the same whether VBAC, that is vaginal birth after caesarean, or elective caesarean section. Hysterectomy. Additional risk from trial of scar is 3.4 per 100,000. And then again requires 2941 elective caesarean section to prevent one hysterectomy. Vaginal birth after the caesarean section, as I told you, the rate of perineal death, it is 11 times higher with VBAC versus elective caesarean section, and this is 2 times higher than for multiparous having a vaginal birth. But this is equivalent to primary, that is having their first child, first birth. Absolute risk is only 4.5 per 100,000 births. All emergency caesarean sections were classified as attempted VBAC. Concluded that the additional risk of perinatal death from attempted VBAC was 1.4 per 100,000. That is 95% confidence limits, that is 0 to 9.8%. All studies concluded this conclusion. In only 5% of the uterine ruptures did the baby die. And this means that one has to perform 7142 elective caesarean section to prevent one baby death. Breech presentations, again 45% of those attempting vaginal delivery had caesarean section. Risk of perinatal death was low with elective caesarean section. Risk of maternal morbidity was increased by caesarean section. Breech presentation, however, 97% of the babies born by the breech, they are fine, and trial differences had disappeared after 2 years follow. And the trial data cannot be generalized to settings where caesarean section is not really available, provided that breech delivery skills are maintained. Selection of the patients for vaginal breech birth, singleton at term, breech with extended legs, and estimated fetal weight less than 3600, that is 3.6 kg, adequate pelvis, hyperextended head excluded, informed and cooperative patient, and again a role for external cephalic version is there. Risks of caesarean delivery. Difficult to quantify because most studies do not distinguish between elective and emergency operations. The reason for the caesarean section need to be considered. Some events, they are rare. The question will only be resolved by a randomized trial with long-term follow-up. More likely with caesarean birth, hospital stay 2-fold increase, intensive care 9 times increase, maternal death 2 to 10 times increase, bladder or ureter damage, that is 30-fold increase, hysterectomy again 40-fold increase, thromboembolism 4 to 16-fold increase, stillbirth in next pregnancy 2-fold increase, placenta previa in next pregnancy 2-fold increase, placenta accreta in future pregnancies. Same rate for vaginal and caesarean section birth, postpartum hemorrhage, endometritis, that is genital tract injury, fecal incontinence, postnatal depression, and back pain, dyspareunia. More likely with vaginal birth, perineal pain, that is 2 to 2.5 times increase, urinary incontinence, 1.6 times increase. Uterovaginal prolapse, twofold increase. Now, more likely with that is cesarean birth, no difference whether cesarean section or vaginal birth, more likely with vaginal birth. So these are the comparison. These are comparison studies which is going on. The differences after the cesarean section: hospital stay increase, intensive care, death increase, bladder ureter damage increase, hysterectomy, thromboembolism phenomena, it is increased, placenta previa in the next pregnancy, stillbirth in course in next pregnancy, twofold increase, and placenta accreta is more chance. No difference whether cesarean section or vaginal, postpartum hemorrhage, endometritis, genital tract injury, fecal incontinence, postnatal depression, backache, and dyspareunia. More likely with vaginal birth, perineal pain, 2.5 folds increase, urinary incontinence, and uterovaginal prolapse, again it is twofold increase. So this is a comparison of the post-operative or post-delivery complications. Caesarean sections, they are popular because caesarean section is convenient. Caesarean section is simple. Caesarean section is safe. Caesarean section is better for babies. When you have done a caesarean, you have done everything possible, the medico-legal imperative. Caesarean sections, they are popular because vaginal birth is painful on the behalf of patient. Vaginal birth is unpredictable. If there is a 1 in 3 or even a 1 in 5 chance of requiring a caesarean section, why not just do one? Vaginal birth ruins your sex life. Vaginal birth destroys the pelvic floor. Caesarean sections are popular because once a caesarean, always a caesarean. The term breech trial, loss of obstetric skills, pressure on medical resources. More caesarean sections occur when fetal distress is diagnosed by cardiotocograph, CTG. There is concern about transmission of infection, for example, herpes, hepatitis C, HIV. There are medical problems and non-obstetricians, they are involved, for example, diabetes, back pain, epilepsy. Patients are privately insured. GPs and midwives compete with specialists. The power of choice. Fathers, they have influence. It is fashionable. Reduced family size. There is an obesity epidemic. Maternal age is increasing. Epidurals sometimes fail. Induction of labor sometimes fails. An epidemic of sexual abuse. My mother and my sisters all had caesareans. This is an IVF baby that is very precious, in vitro fertilization. Evolution of the species. Thank you very much. So this is all about the why the caesarean section, comparative study of the caesarean section and VBAC and vaginal delivery, of course, and then why it is increased in different reasons are given. Thank you very much. Hope it will help you in increasing knowledge. Jazakallah khair.